Foundation was founded in 1993, actually from the sale of Cedars Hospital, and initially focused entirely on improving healthcare in our community, really focused on addressing the healthcare challenges that we're facing South Florida. And over time we've evolved into an organization, and we're the largest philanthropic organization in South Florida, focused entirely and exclusively on addressing opportunities to improve the health and well-being across our community. The mission of the foundation is really clear. We're advancing health equity and looking to improve the health of our community. And we do that by addressing healthcare challenges as well as the underlying issues and the barriers like social determinants of health that often are the underlying cause for the disparities that we're trying to address.
Approximately 7 years ago, a very dear friend introduced me to the Health Foundation, and it was as if sparks ignited at the moment. The Health Foundation really embodies everything that I believe in as a healthcare leader and as a community advocate. So the Health Foundation really serves as a vector for that connection and ensures that we remain connected with sustainable solutions to improve the health and well-being of the communities that we serve.
You know, transformation is a word that's sometimes overused, but I think it's an appropriate word. And the work that we do at the Health Foundation is just that, to transform communities that have needs.
Access to care is a cornerstone of our work. Ensuring that individuals can access care when they need it, where they need it, and that they can actually afford it is critical to advancing our mission of improving health. This is why the foundation makes investments in community-based organizations that are supporting individuals to enroll in health insurance, because we know that that's an entry point to the system of care, as well as in community health clinics that many times serve as safety net for a lot of individuals that may be uninsured or underserved. At the end of the day, we want to create a system of care that is equitable, accessible, and affordable.
When we make our decisions and we make our investment decisions, we work really hard to look at what are the gaps that we need to close in healthcare, but beyond that, what are the root causes and drivers for these disparities, and what do we need to do to solve them? What resources can we bring to bear? Who can we bring to the table so that we can remove the barriers and advance health equity?
At the core of our work is cross-sector partnerships, collaboration, innovation, and a deep commitment to addressing the root causes of health disparities. One of the flagship initiatives of the Health Foundation of South Florida is the South Florida Anchor Alliance, which is a powerful coalition of 20 anchor institutions spanning healthcare, education, government, which have come together around the shared vision of creating a healthier, more vibrant, thriving South Florida.
I'm happy because the Health Foundation of South Florida understands the importance of equity, not just in health, which is our ultimate goal, but in health care. We are an organization that attempts to raise the level of all individuals in South Florida as it relates to their health.
We know that 80% of factors that impact health occur outside of a doctor's office. So whether an individual has access to quality, affordable housing, whether they have food security or access to healthy foods, whether they have transportation challenges, all of these factors will impact their health outcomes. And this is why we have been partnering with healthcare providers to implement projects and efforts that look at the patient in a more holistic manner and addresses these social and economic challenges that impact health, because we know that it will improve health outcomes. One of our major initiatives is the Health Equity Collaboratives, where we are bringing together healthcare partners and community-based organizations so that they can address those social needs and improve health outcomes in the long term.
I'd like to invite every partner that has stood by us at every time that we have celebrated small and big wins with, to continue to remain by our side, to inspire us, and to continue to ignite the fire that powers the Health Foundation and powers our community.
I invite you to join us on this journey where we're building a healthier and more resilient South Florida, one where every member of our community can thrive and succeed.